Good morning, everyone. On behalf of the Board of Directors of Friends of Recovery New York, on behalf of the staff of Friends of Recovery New York, along with the New York Alliance of Recovery Housing and the New York State Alumni Association, we welcome you to this day of action where we discuss all things housing. One of the elements of For New York's mission is that we continue to wrap around and advance policies that impact the recovery community. And one of the ways that we inform policymakers and the greater New York community about our voice is bringing our voice directly to you. So that's what we will do today. We will have members of the recovery community discuss recovery housing. And so, first up, we have a special guest for you guys. I will be introducing Mr. Fred Way. Mr. Fred Way has a master's degree and is the founder and executive director of the Pennsylvania Alliance of Recovery Residencies, PAR, and president and charter board member and president of the National Alliance for Recovery Residences, NAR. Lots of acronyms today, folks. And was the former administrator for special initiatives for the City of Philadelphia's Department of Behavioral Health and Intellectual Disability Services Office of Addiction Services, in which he worked for 18 years before departing in December of 2010 to build PAR, the NAR Pennsylvania state affiliate, into an emerging 501c3 nonprofit. Fred has dedicated his career to working and assisting individuals with substance abuse and mental health challenges, all while creating an atmosphere of change within his oversight of over 200 staff employees during his career, which he has led by example and helped to create and mold leaders within the behavioral health and recovery residence systems. New York, it is my pleasure to introduce you to Mr. Fred Way.
Good morning, and thank you for that awesome break-in, Dr. Wilson. Good morning, all. Again, I'm Fred Way, and I am the president of the National Alliances for Recovery Residences, and I'm here to talk to you about NAR. NAR, let me tell you about this story. Early on, we came together, a group of us, like-minded individuals who felt as though something needed to be done for recovery residences, and that was to create a standard. And we came together in the year 2010 weekly on a conference call to start creating the foundation for the standard that we now have 3.0. Founded in 2011, the National Standard and the Code of Ethics, and we cover a full spectrum of recovery housing. We are the operating model for statewide recovery house support. We have affiliates in 31 states at present and 7 others that are emerging. So that means that NAR, if you look at NAR as the starship and the affiliates, there are the little spaceships that float around it, because the affiliate is who does all the work. The affiliates does all the certification. The affiliates does all the on-sites and technical assistance for the recovery residences. The certification program that we have is by far one of the best ones I've seen. Okay, that where we work with the individuals from start to finish, where we help them create their policies, their procedures, and help them make sure that their physical standards are all correct with their house before we come out to do an on-site visit. And if you know about recovery housing, it was mostly ignored and unregulated under an existing system. Firstly, there was no consumer awareness and there was no accepted standards until now. Regional support was sparse, but now at this point in 2022, recovery residences are at the forefront of what we're doing and being able to house those individuals who need that time to be able to get their life in order before they come out to be into permanent housing. The elements of the statewide recovery residence system as an affiliate is an annual process, a formal application process, review of the residence documents, policies, and procedures, structured interviews, with the operators, along with the operator staff, and the physical site assessment. We're looking at the health and safety, no overcrowding, and property condition. And we have technical assistance with the operators all the time. We love to say that at this point, recovery residences are at the forefront of trying to house those less marginalized individuals that, in some other case may end up on the street. And we want to make sure that they have the opportunity to recover, to live a long, self-sustaining life. Recovery housing, the NAR standard, which is now at 3.0, okay, it's 4 levels: level 1, level 2, level 3, and level 4. Yeah. So therefore, you can go into recovery housing at any one of those levels. Where you may have heard of other organizations such as the Oxford House, which is only has one level, which is a level 1. Having been in many, many recovery residences over the last 11 years, I must say that working with the NAR group, which has been the core group of individuals who I must say are the most ego-less individuals that I have ever worked with. And I must say that we continue to do tremendous work. And our next work that we're doing, that we will be working with the NISAR group here in upstate New York, okay, to make sure that they are up, running, and be able to certify recovery residences in upstate New York. The next project that we are on, and we will definitely be looking forward to working with them. So again, I would like to thank you for taking the time to listen to me, and hopefully if there's any questions at the end, I will be able to answer them. Thank you.
Thank you, Fred. And why is this important, folks? Well, what you will have before you soon in New York State is legislation that will be deciding on the certification of residence housing. And so it is important for our community to come together, to create a voice around recovery housing, and to be informed about the certification of recovery housing. And so that's what this day of action is about. It is about bringing information to the recovery community so that when it is time for us to make a decision with regards to the legislation that will be forward, you have been informed. You would have been informed by some of the community members that are continuing to do this work around recovery housing throughout New York State. And that brings us to, what do we have going on in New York State? Well, we have the New York State Alliance of Recovery Housing, an affiliate right here in New York State. So please allow me to introduce the representative from NISAR. We have Mr. Van Smith, who is the founder and executive director of Recovery Houses of Rochester, which has operated recovery housing for men since 2002. He is also the co founder and the president of the New York State Alliance of Recovery Residents, NISAR. Van has over 20 years of experience in leadership and management in the field of substance use disorder, with specialized experience with developing recovery housing and recovery oriented systems of care. Ms. Lauren McNamara has been working in the field of mental health and substance use disorders for over 14 years. and is a licensed master social worker. She too is the co-founder and the chief operating officer of New Hope Rising, a nonprofit organization that provides safe, supportive recovery housing for men and women on Long Island. She is also the co-founder and vice president of NISAR, and she has an extensive experience in nonprofit leadership and recovery housing program development. So, recovery community, I bring you Van and I bring you Lauren to talk about what NISAR has been doing and continues to do throughout New York State.
Thank you so much for the introduction, Angelia. I'd like to extend a huge welcome to all attendees and thank you so much to all of you for joining us today. Van Smith and I are here today to represent the New York State Alliance of Recovery Residences, or NYSAR, to give a voice to recovery housing operators and to talk about what recovery housing is, why it's so important, and finally, what NYSAR's purpose and goals are. Van, let's begin with talking about the basics of recovery housing and the important role that it plays in the continuum of care for those with substance use disorder.
Thanks, Lauren. And I'm here to talk about recovery housing as it refers to a safe, healthy, and substance-free living environments that support individuals in recovery from substance use disorders. While recovery residences may vary widely in structure and services, all are centered on peer support and a connection to services that promote recovery. Although no two recovery homes are the same, they all share a common goal to residents to help build a foundation for long-term recovery and to provide a safe living environment where residents can address areas of their lives that may have been impacted by substance use disorder, such as employment, mental health, accessing medical care, resolving legal issues, life skills, and family relationships. Many recovery homes are organized under the leadership of house managers who are typically in recovery themselves and who provide valuable support and guidance through lived experience and their own recovery process. Leading by example, like we'd like to say, many homes require residents to participate in outpatient treatment with local community treatment providers and or in a recovery program, such as a 12-step and or mutual aid groups, other mutual aid groups. Recovery housing is a part of a recovery-oriented systems of care following a social model, which is mainly peer-led. The social model has a long-standing history of efficiency with the recovery community and is different from the medical or clinical model that offers other levels of care. Recovery housing has its own unique and important purpose and role in the continuum of care for those with substance use disorder living in the community. Recovery housing structures range from, as we've heard already, independent resident-run homes to staff-managed residents where clinical services are provided. The National Alliance of Recovery Residences, NAR, has classified 4 levels of recovery residences, as we've already heard. The levels are differentiated by the rules and organizational structure of the home and the types of services and supports that are provided. Additionally, NAR provides ethical and principles and measurable quality standards for operating recovery housing across the 4 levels. Regardless of how structured a program is, there are standards and ethics that are identified as best practices to be followed. NISAR has adopted these levels, standards, and ethical principles developed by NAR and is in the process of developing a voluntary certification process in New York for recovery homes. Now I'd like to talk a bit about NYSAR and what its goals and functions are. The New York State Alliance of Recovery Residences, or NYSAR, is the New York State emerging affiliate for the National Alliance for Recovery Residences, NAR. NYSAR is a 501c3 nonprofit organization with a mission to support people in recovery from substance use disorders by improving their access to quality recovery residences that operate according to standards and ethics developed by NAR. NYSAR's work in collaboration with recovery housing operators, agencies, treatment providers, and recovery allies throughout New York State is to ensure that safe, stable recovery housing is available and accessible to those who need it. We are grateful for the technical support of the Opioid Response Network and Beth Fisher Sanders, former president of NAR and the current chair of the NAR Standards Committee. Our leadership team works with work groups tirelessly to develop NYSAR, as well as our volunteer employee, Katie Mancini, who we would also like to thank the United Way Synergy Fund, which recently awarded NYSAR grant funding to assist with our infrastructure development. We also provide support and guidance to recovery housing operators who are seeking information on everything from recovery housing best practices, ethics standards, operational concerns, how to open and properly operate a new recovery home, and the path to voluntary certification. Now, Lauren will speak about NYSAR's goals and why having a state affiliate with standards, ethics, and certification is so important. Lauren.
Thanks so much, Van. So one of NYSAR's main goals really is to make sure that recovery housing is safe and more accessible in our state, and to support recovery living options for people who are seeking a variety of different levels of care, whether they're coming from inpatient treatment or detox or incarceration or other community living arrangements. Additionally, we really want to increase access to safe recovery housing for those utilizing medication-assisted treatment and other pathways to recovery as well. Having a recovery housing affiliate in New York is important for accountability and oversight. And we're no longer just hoping that recovery housing providers are operating their programs appropriately and ethically because it's the right thing to do. Recovery housing operators and other allies came together across New York State to create NYSAR to really create a system of accountability and checks and balances with a rigorous certification process that involves independent, unbiased site reviews, interviews with staff and residents, documentation reviews, and a yearly renewal process. Our certification process would be far from an easily obtained rubber stamp and will serve to increase the availability of quality recovery housing options, while also calling on providers who have been operating with deficiencies to rise to the standards and improve their programs. We believe that with support and resources given to all providers in New York, we can improve the quality of services and increase safety measures in our state. We at NYSAR are thrilled that recovery housing was mentioned in Governor Hochul's State of the State and that it was also included in the New York State budget recently. While we are encouraged that recovery housing is finally being publicly recognized as such an important part of the continuum of care that it is, we are asking that the voices of people in recovery and the collective voices of recovery housing operators through NYSAR are heard and included in the process of implementing standards, ethics, and voluntary certification in New York. NYSAR has been working diligently for the past 2 years to implement these improvements and is made up of a collective group of providers, other interested recovery allies, with many years of experience and knowledge between us. This is not really about individual recovery housing operators, organizations, or individual people creating new standards, reinventing the wheel and hoping that it all works out for the best in a few years and that recovery housing somehow improves in New York by chance. This is really about adhering to research-based standards, ethics, and a certification process developed by NAR, which has worked so well to improve safety and quality of recovery residences, as Fred had mentioned earlier, in 31 other states since 2010. We are asking for OASIS in New York State to trust our experience through NYSAR in the area of recovery housing and the social model. In short, I'm asking you not just to trust us because we're here today and our names are Van and Lauren, or even because we're recovery housing operators who have been doing this work 30 plus years combined experience between our two organizations, but really trust us because NYSAR is a collective voice with a mission and vision that we're so passionate about. Our hearts are in this work to improve the status quo in New York. We adhere to a board of directors and a set of standards and ethics that are based on evidence and research, not developed by NYSAR itself, but by the National Alliance. We are part of a national network that can testify to the success of the standards and ethics in other states and their programs. And we're doing this because we believe that people in recovery deserve better and have a right to live in safe, clean recovery homes. Now, having standards and certification and resources prevent issues from happening in recovery housing, issues that many know have been too common in New York for too long, issues that when prevented have the potential to save lives of those living in recovery housing, improve quality of life, and improve our communities at large. We really want to see those living in recovery housing having access to living in a safe environment where they're protected and free from exploitation and overcrowding, where they can thrive and focus on building a foundation for long-term recovery. And let's face it, people in early recovery experience enough challenges. They deserve to have their basic needs met by, having quality recovery housing available to them. I'd like to close our portion of today's discussion by stating that while certification is important in our state, along with that is also the need for resources and funding for recovery housing so that operators can better meet the needs of their residents. And so importantly, that residents with limited financial means have more equitable access to quality programs. So on behalf of Van and myself and all of us at NYSAR, we thank you for the opportunity of being here today to share our experience and perspective with you all. I would love to now introduce our next speaker, Jessica McNamara. Jessica is a person in long-term recovery who has been working in the field of substance use and mental health disorders for 5 years. She has lived experience residing in sober living herself, as well as experience with recovery housing as a provider. Jessica is a CASAC and has earned her master's in social work, and she is currently the assistant clinical supervisor at the Long Island Center for Recovery and serves on the board of directors for New Hope Rising. So without further ado, I'd like to introduce Jessica to you all.
Hi, everyone. My name is Jessica. I'm a person in long-term recovery. I'm so nervous right now because I'm so passionate about this cause and this initiative that I'm praying that I do it somewhat justice. This affects me. This affects the people I love. This affects our community as a whole. So just very briefly, I struggled with addiction for many years. I lived to use and used to live. And throughout that, my journey to recovery was very long. So it included many inpatient treatments, many long-term treatment centers, and sober living. So I've been in tons of sober living, some good, some not so good. And you know what? I'm really grateful today for that experience because it has shown me the lack of resources, the lack of support, and the areas that we really need to focus on as a team to make recovery housing just better for the people that we serve. So, yeah, I've gone to, just for an example, like I've gone to long-term treatment, right? Like I said, and so for 90 days, I was in this recovery center. I was getting stable. And then I was sent to a sober living home after, and that was one of my first experiences. So when I got to this sober house, I was completely shocked. Like it seemed like I was stabilized for 90 days and then set up to fail completely. And it's not to, that recovery center's fault that sent me there, because I know now as a provider how you're kind of just looking for housing, and, this place is near where they want to be, so we'll try it. But it's just unacceptable. When I went to this sober house, it was, like Lauren just said, overcrowding. Like, I mean, we're talking like 6 people in a room, bunk beds, like barely any space for me or for my things, no structure. Just for some examples about, the physical environment, I mean, I've experienced, bed bugs and roaches and rotted food. Like, sometimes when you're paying rent or using public assistance, they'll take, instead of you getting the food stamps, they'll take that portion to provide food. However, I've been in several situations where instead of buying food with that money, the house will provide donations, which have already been rotted. So again, like Lauren said, like my basic needs weren't being met. And not only does that affect your physical environment, but for me, as someone who has struggled for so long and felt like I just couldn't get recovery or didn't deserve recovery, because I know for a lot of us, but I'll keep it in the eye, felt like I didn't really deserve anything, because I had been such a bad person. So that just kind of reinforced my negative thinking that, this is what I deserve. So it was degrading. It was degrading in a sense, and just did not contribute whatsoever to my self-esteem or self-worth. The lack of structure, going into sober living from 28 days or from detox, and maybe being ready or not being ready. But I've seen, people, I go into the house and it seems like people are people are not getting out of bed. People are just not living in recovery. So, in an ideal world, I would be like, well, I want to get sober, so I'm going to do what I have to do. But it's just not that easy in early recovery. So your surroundings are going to affect the way you act. So when I'm seeing people getting away with things and continuing to live there, and, basically as long as you can pay rent, you're good to live in this sober house. That was very triggering for me. And that told my addict brain that I could use one more time, or I could use and get away with it, or I could use and my grandparents will not be like devastated for the 100th time, as I come crawling back, begging for help. So I have been to some great places, right, that provided structure, support, love. I began to manage a home where I was looked up to and I respected the people that lived in the house. I've been in houses where I was fearful and intimidated by the house manager. So what kind of support is that? And when I got to work in an environment that really was engaged and went above and beyond for these individuals, it was like a breath of fresh air. It was like, this is what we should be doing. And since then, I've been like on this mission to like, please, let's get our people somewhere safe and supportive to live. I've had family members that suffer from this disease as well that I've, tried to find resources for. And it's very scary when I know that they're not going to a place like that. And on the other hand, extremely relieving when they are going somewhere where I know they're going to be safe and taken care of and loved. I'm like so thrilled that we're heading in this direction. I am just overjoyed. I mean, as now a provider, instead of being excited, I mean, don't get me wrong, I'm excited when people say they want to go to sober living, because I'm like, rah, rah. But something inside me also cringes because I know that there are so few choices for me that I trust. And I know that people need that structure, support, healthy food, healthy environment, helping with resumes and finding employment, and someone cheering you on instead of making you feel like worthless. I know that I was so low, I really needed to be uplifted. And thank God I had that opportunity, because if someone didn't lift me up, I wouldn't be here today trying to lift people up. And although I felt so bad about myself then, I'm awesome. Like, I have great self-esteem today. I know I'm worth something. And thank God that these good sober homes that have this structure that we're looking to execute, were there for me to show me the way, because I needed that love, that sense of community and purpose and accountability, people watching and knowing that if I don't do the right thing, I didn't always have great integrity. If I don't do the right thing, someone's going to know, and I want to keep on this path. So I'm just so happy to be here, to be sharing my story. I hope that someone has heard me, and I hope I did this cause justice, because it is so important. It is so important. Recovery is possible, but we need to support our community to make sure our people are going to safe housing. Thank you.
Thank you so much, Jessica. Thank you. Wow, I'm so blown away, and we so appreciate you being here today. Thank you for sharing your voice, your experience, strength, and hope with us. Just really appreciate you taking the time to be with us today and share your story. Now I would like to introduce Christina Donor. Christina brings her perspective into today's meeting as a family member of a person who has lived in recovery housing, and she will be sharing the impact that recovery housing has had on her sister's recovery journey. Thank you so much, Christina.
Thank you, Lauren, and thank you all for having me here. I want to be a part of this because the recovery housing has been so vital for my sister's recovery. It really brought her back to us and to her family. I want to start just, my sister was an addict for many years, but before that she was, and always has been and still is, a fantastic person, great soul. She helped me raise my son when he was born. For the first few years of his life, she was right there with me, and she had such a bond with him. And during the height of her addiction, she almost lost it. And she hid a lot from us as a family. She didn't think she deserved our love and our support. She hid it to the point where we really didn't understand it and know it, to the depths of where she was. There were years she would come for holidays and be her bright, vibrant self, but only be there for about 15 minutes, say she had to go to work, and hide and run off from us. It wasn't until she had a conversation with my son one year, and after that she took off without telling anybody, that we really started to think, these actions aren't exactly what we know her to be, and thought maybe there was something more. But again, it wasn't known to us. I didn't maybe want to see it as her sister, as her big sister, wanting to know I could take care of her. So that was tough when we finally found out how deep she had gotten when she was arrested and put in jail, and we couldn't get her out right away. She had to go through a lot. I had to visit her in jail and wanted to see where she really was and see what I could do from our side to really support her and let her know we are always here for you. We have always been, and we want to still be here for you, to support you in any way we can. As a family, we are here forever. So she finally was able to see that. We saw her recovery. She wrote notes to my kids while in jail. We did end up telling them everything she was going through. We wanted them to know all about her struggles. And as a family, we come together and we support each other. And she knew that they loved her no matter what, and they were still here for her. and will always still be here for her. And from that point, she started getting better in our eyes, going to AA and things. And then we had a big family setback. My father passed away, and as bad as it hit all of us, it really hit her in a very delicate place that she was in, and she relapsed. She was sent back to jail, but after that, they really saw where she had been in her progression to recovery, and they took that as a sign of her, wanting to get better, and they put her in a New Hope Rising home, and that's where we really got my sister back. I got her back. I got her to see her feel safe and to feel comfortable in her skin again, and to have a support system where she lived. And this home really pulled her around. She got a job and was able to hold a job. She went to therapy. She went to AA. She did everything they told her she needed to do, and she wanted to do it. And her whole just outlook on life, we saw the light in her eyes come back. And I was able to pick her up and meet the people in the house that she shared. And it was a great atmosphere, beautiful, clean home, very supportive, very, very supportive. I was able to have my kids come with me. They'd be in the car when we come and grabbed her. So they were able to see she had a nice, safe place to live and support her. And it was really great. This house, she was there for, I believe, 7 to 8 months before she moved out on her own, kept her job, kept going to AA, was leading meetings. I was there for her 1-year clean meeting, and it was a breath of fresh air. She was finally the person I grew up with. She was back to being her fabulous, vibrant self all day, every day. And after that, as of February, she has moved back into the house, but as a manager. She's now helping people that were like her at the beginning stages and middle stages, and she's able to help them in their recovery as well in this house that's safe. She's also signed up for school and going in the fall to be a KFAC certified alcohol and substance abuse counselor. And I couldn't be more proud of her and her determination to be who she really is and be clean for the rest of her life. And it's a struggle. And just as a family member, to be able to have a house that was close to us, to see her and to see her recovery was very vital for the rest of the family. So I want to thank you all for doing everything you do to help people like my sister and our family get better.
Awesome. Thank you, Christina. And thank you, Jessica, for shedding some light on us and your experiences with recovery housing. So we want to keep you informed. So now we would like to bring you a perspective, recovery housing from a veteran's perspective. And so I will be introducing Mr. Eric Malik Hutchison, who is a KSAC as well as a SERPA, and is the Director of Residential Services at ELMCOR Youth for Youth and Adult Activities. Malik is well respected in the recovery community and acknowledged not only for his work through ELMCOR and his role in the New York State Alumni Association Steering Committee, but his passion for speaking on perspectives of veterans, in particular veterans in recovery, which has made him a staple at numerous conferences throughout New York State. And so it is my great honor to introduce my collaborator, my friend, Malik Hutchison.
Thank you. Thanks, Doc. Or as always, I'm so excited. I have to bear with me because I'm going to try to hold my excitement. But on my path and on my journey, I've ran into several people in my research when it comes to veterans supportive housing. And in my over 20 years experience in veteran services, I was in charge of a program called Supportive Services for Veteran Family. I helped ignite it and initiate it in New York City. We got to what was called, quote unquote, a working zero, because it's pretty impossible in a major metropolis like New York to kind of have zero homelessness amongst veterans, but we got it down to a respectable number, as we all called it in the services. So through that, one of the hurdles that I'd like to mention was the HUD rule. The HUD final rule stated that what would happen is, and in my recovery journey, what would happen is a person who was in a shelter is considered homeless. That shelter might have drug use, rampant violence, unsafe environment for that person. So that person would decide to go into, say, treatment and to get stabilized and get back on their road to recovery. So they'll go into treatment just to find out that once they enter treatment, that they are no longer homeless. Okay, I left shelter, went to treatment, now I'm no longer homeless. So now the eligibility for housing I no longer have once I start taking care of myself in treatment. So now I'm trying to get out of treatment and I can't because my housing isn't affordable and I don't have no support in line in order to help me. So I'm so excited to see that somebody's listening to us now to really want to do something similar, to have supportive housing for those in recovery. In my research, I looked up NAR. I did my studies. I traveled to Philadelphia. I met Fred Way. I'm so excited that he's doing the work he's doing. I met Van in my journeys. Just and to see it all starting to come together, it's so beautiful. I went on and started advocating for veterans under the SERPA. So I felt that, there needed to be a specialty designation for veterans when it came to, those with lived experience and peer-to-peer support. So I was fortunate enough to do a presentation for ASAP, New York Association for Addiction Professionals, and we were awarded a grant by the Cabrini Fund, and we were allowed to create a designation called Veteran Services Representative, which allowed those people, as Van and Fred mentioned, those house managers or all those people who are providing services, they can have actually another specialty designation and really help those veterans navigate through the difficult road that they may have in their recovery process, all the way to housing and being able to also support them in that experience. So it's imperative that we continue to hopefully get this rule changed where those that are in treatment can receive that housing, that recovery housing. NAR is the example by far to follow. NYSAR, which is an affiliate of it, is the example to follow. It's tried and true, as they mentioned in other states, and New York needs to really join in. We're glad that Oasis is lending their ear to us, and we have a standard that can really work for our veterans in the community. New York City, big metropolis, needs this. I'm one who, had a sober house, had standards that were similar to NAR, which I'm so glad when I saw it, I said, oh, this is the road to follow, because you want to make sure that you're providing the best quality services that you can provide. So I'm just so excited to hear that this is happening. So it is important for us not only to do this in New York, but we need to go to a federal level and speak to our new Secretary of HUD, Marsha Fudge, who is very interested in hearing situations like this one on a national level, and we can go ahead and maybe get this this final rule changed or amended to allow those in treatment to continue to receive the needed support that they need to continue their recovery journey. And what better way to do it than do what we're talking about here today? So that's my next mission. I love what's happening. I love to be a part of what's happening. And I want to make sure that my stamp is on New York City and the greater New York area to make sure that this well-deserved support for our nation's heroes. Just think, we just ended the longest war in our history. When I began my advocacy, it was for the Vietnam era veterans. Vietnam era was in 73. It stopped in 1973. I was continuing to advocate for veterans from the Vietnam era. So just imagine what we have ahead of us now for the longest war in our history. And I just, continue to hope and pray that we continue to join forces together and do what we're doing. I thank y'all so much for allowing me to come on this and be a part of this wonderful experience. The New York State Alumni Association, this is another piece in this is another niche in our armor to continue to do the work that we provide. And I thank y'all so much for having me.
Thank you so much, Malik, and thank you for your service. Thank you for your advocacy, and thank you for bringing that perspective about the veterans and in New York City. There's such diverse needs around the state, but I think that it's true everywhere that we need access, we need safety, and we need accountability, and that's what this is all about. And also, I'll be staying wherever you are, Malik. I like that background. So now, first of all, let me introduce myself. I haven't been on this platform yet. Today, I'm Allison Weingarten, and I am the Director of Policy for Friends of Recovery New York. And as a conclusion to today's program, we have an action. Friends of Recovery New York has invested in a new platform to help our community easily, effectively, efficiently reach their elected officials in just the click of a few buttons. So many of you, hopefully all of you watching, are actually on our email distribution list. And so just a few minutes ago, we sent out an email to around, maybe 7,000 New Yorkers, asking you to contact your elected officials and say thank you. We are so glad that recovery housing was included in the New York State budget. And we want to see the recovery voices, people with lived experience, family members, and the housing operators that are adhering to NAR, National Association on Recovery Residencies standards. Many of them are a part of the new NYSAR, which you heard about today. And so we sent out that campaign. And we are also scrolling it in the comments, and it will be available on the For New York Facebook page for you to click. Just a few simple clicks of a button, and you can contact, I think there's about 10 elected officials for you to contact simply and effectively. So you are contacting the governor. You are contacting the commissioner of OASIS. You are contacting the whole Senate and Assembly committees on alcoholism and drug abuse, and you are contacting your local assembly member and senator. And so we are so excited about this first kickoff of our new platform for this incredibly important issue of recovery housing and ensuring that the experts are at the table. So with that, we are going to open it up to any question and answer. We will be taking question and answers from the comments page.
Does anyone have any questions that they would like to ask today? We're happy to answer anything that you had, anything about recovery housing, anything about policies that are coming down the pike in legislation. Claire is asking, what is in the budget? Allison, can you speak to that?
Hello, Claire. So what is in the budget? So this is a very interesting question, actually. There is a very simple one paragraph in the budget that says that New York State will be creating, oh my goodness, I should have had it in front of me, but creating standards for recovery housing. I can say that it is just very simple. And we appreciate that because that leaves a lot of room for us as the recovery community and the experts, those who are, a part of NAR and NYSAR, to get involved and give all of the lived and true regulations and understanding of these standards, so that we can have a voice at the table. So that's exactly what we're asking today. Taking that very simple part of the budget, which we are grateful for, but asking that as that is developed further, that the voices of recovery are included. So
there's another question from Philip. Will For New York be participating in Legislative Day?
So will For New York be participating in Legislative Day? So we had our Stand Up for Recovery Day back in February, actually a month ago today. I think I finally got enough sleep in now in the past 4 weeks. But today was another day of action, but we don't have another specific legislative day planned. So Lauren, there's another question in the chat, and it says, what is the difference between sober and recovery housing?
Sure, that's a really great question. So previously, the language regarding sober living, sober housing, that was the general term that was used for housing for quite a period of time. The language is changing to be more to more reflect recovery. So recovery housing, recovery residences, recovery homes. And the reason for that is that the term recovery housing really is more all-encompassing of what recovery is and what it means to be in recovery. So it's really about more than just that physical sobriety piece, which is what sober housing kind of entails or suggests. Recovery housing really means that individuals are there not just getting physically clean and sober, but they're really working hard on other areas of their lives that were impacted by active addiction. So they're working on becoming employed again. They're working on becoming self-sufficient. They're working on, repairing their family relationships, reconnecting with their communities, going back to school. So it's about so much more than just physical sobriety. And so changing that language into being more recovery oriented, more, in line with the recovery oriented systems of care that recovery housing is, that's where some of that language is changing. And that's something that we're pushing for as well, is just to make sure that the language is consistent and that it really encompasses more completely what it means to be in recovery. For a variety of different people, it may mean something different for each person, but that's sort of the beauty of that language. Okay.
Lauren, I have a couple more. I have a question here from the wonderful Sue Martin. And then I guess, Sue, you gave two. Always on your toes. And then I did get an email also from Michael Carpenter. So let's start with Sue's first question. Do we have information on how to start sober housing or a link for establishing the not-for-profit?
Sure, I can take that question. So actually, that is part of what NYSAR does in New York State. We have met with so many individuals, at this point, who are interested in starting recovery housing, sort of learning like the ins and outs, what is the right way to start like a properly run recovery home. So that is definitely something that we at NYSAR can assist with. We do have like private, meetings with individuals who are interested. We also have, on a monthly basis, we have our open meetings for NYSAR, where anyone in the community can join those meetings, get connected with other recovery housing operators, get connected to resources and information, and just other people who are really interested and passionate in recovery housing. So that is always an option for anyone who is interested in getting connected. And we can also send out, information to anyone who's interested regarding that meeting. There is an option to actually go on our website, which is nysar.org, nysarr.org, and you can actually see the option to sign up for our open meetings. In terms of establishing a nonprofit versus a for-profit recovery home, there are, of course, pros and cons to either structure. Of course, we're happy to answer any questions about that. Individually, if someone has questions regarding starting a not-for-profit, we can point the direction for some resources for that.
Awesome. Thank you so much. And I'm glad to see some comments in there, even if it is from my work buddy, Teresa, that says that it was super easy to click those links. I hope it is for everybody. So Sue also asked a question, are there any dollars from the opiate settlement designated for housing? So I will say that to my knowledge, there is not yet, but that is part of the advocacy that we're doing, that, when these dollars come through, housing is a top need of the recovery community, and we would like to see funding to support recovery housing. Do you have anything to add to that, Lauren?
No, I don't believe so. I think you summed that up, and that's something that we would, advocate for as well, is to be able to have access to that funding as well, so that we can, just continue our mission and improve housing throughout the state. There's another question here about the potential for a list of certified recovery housing. So that is actually also something that NYSAR is working on, as well as developing an information database across New York State, first and foremost, to obtain the information for recovery housing that's already in existence in our state. So looking at, everything from, what services they're providing, what demographics do they serve, where are they located, how do you complete an intake, how do you refer someone to them? And so we're building that database right now. And then ultimately, with the certification process, there would actually be a list of online available certified recovery housing, so that individuals in recovery can access that information, knowing that they're, going to or seeking or looking into a certified home for quality purposes, and also even for treatment providers as well, to be able to see that and know that when they refer someone to a recovery home on this list, they know that there is a certification process that they've gone through, and that they can, rest assured that it's a quality residence.
Thank you so much, Lauren. Let me get this one question in, and Jeff, you can share some of that in the comments. But this came in from Michael Carpenter. Can you talk about medication-assisted treatment in recovery housing, and if you can deny residence for people on MAT? Also, can you mandate 12-step meeting attendance, and addressing marijuana use, both medical and recreational, and what the plan for all of that is? Big questions.
So I'll take that. So each recovery home may have its own set of, rules, policies, and procedures that they follow. One of the great things about the NAR standards is that even though homes may be different with a different set of rules or different criteria for housing, everyone has a place, and everyone has, a place in the level system where there are still standards and ethics that apply to that level. There was multiple parts of that question. Allison, what were some of the other parts? I'm sorry.
Can someone be denied recovery housing if they use medication-assisted treatment? Can you mandate 12-step meetings? And what is the plan for medical versus recreational marijuana?
I think that some of that is a gray area. I think that as standards are implemented in New York and things, sort of we start the certification process and whatnot, I think that that will become more clear at that time. Again, each, as it stands right now, every recovery home has its own set of, rules and regulations and criteria to reside with them. Of course, like residents in recovery also have the ability to choose what home is right for them. So, that would be my general answer to that at this time, until things, until the certification process begins.
Thanks, Lauren. Okay, another question from Philip Williams Cook. I'm currently launching a 501c4 social welfare nonprofit organization called Hope and Success for the People. Pierre Champlain, Sandra Mitchell, and I are the incorporators and co-executive chairs. Well, congratulations, Philip. Sorry, that wasn't the question. What about housing for couples in recovery, including same-sex couples? And I think that's a good question for families as well.
That's a really great question, Philip. Thank you for asking that. This does come up from time to time, and I think it's important, just as we were speaking earlier about there being many different pathways to recovery. Generally speaking, traditionally recovery housing has been sort of, single gender specific, where couples are not residing together. However, different folks in recovery have different needs and different things that they're looking for in their living environment. So that is something, that we would definitely, love to see throughout New York State, but also just being aware of those resources as well, which is why NYSAR is important. So that when there is a resource like that and someone is looking for that, specific, aspect of their recovery housing experience, is that we know that is out there. Hopefully it's a certified recovery housing program, so that we're aware of that resource and we can point folks to that, to that resource moving forward if that's what they're looking for.
Great. Thank you so much, Lauren. One last question, and I think you started to address it, about from Jason Pisano. Are residential treatment programs aware of NYSAR services to ensure that those are in treatment are referred to appropriate housing upon discharge?
So that is actually the hope for us with NYSAR, is that we are working in collaboration with treatment providers. We're working in collaboration with OASIS, so that OASIS licensed treatment facilities that are, largely referring people to appropriate recovery housing upon their discharge, that we're working hand in hand so that those quality resources are available, that there's an available list where people know where they're sending their patients to when they leave treatment. So the goal is for us really to all work together so that everyone is aware of the certification process and what what is available, and that you can be assured that it would be a quality program to send someone to following treatment.
Great. Thank you so much, Lauren. Now we will bring up Angelia to wrap us up.
Wow, this has been amazing. Recovery community, you've been activated, right? We brought you information on what New York State is already doing, has been doing around recovery housing. We brought you individuals who have been in recovery houses. We brought you family members who have experienced recovery housing. We brought you the veterans' perspective with regards to recovery housing. So you have been activated, right? Allison showed you how to contact your local representatives so that your voice can be heard around recovery. Friends of Recovery is so grateful to the governor, to the current commissioner of OASAS, Commissioner Cunningham, for listening to the recovery community and wanting to move recovery housing forward. And we will continue to work with our legislators, our state office advocates to ensure that recovery housing truly becomes your own. You make it your home, where individuals can recover in their own space, at their own pace, and receive whatever they need to do to ensure that they have access to a meaningful and purposeful life. So thank you so much. Continue to visit Friends of Recovery's Facebook page, social media, Instagram, all of those things to stay in the loop and stay informed as we continue to bring you all of the issues and concerns that the recovery community has so that our voice is always, always heard. Thank you so much.